we're going to find a way to smile as we work our way through this. Okay, today, certainly, again, pleased to have Mayor Pro-Tem Dave Martin with me and Councilmember Edward Pollard of District J, along with Dr. Persse, Chief Pena, and Chief Pena. Over here, okay. Okay, well, let's get right in. Thank you all for joining us again today. Today, the Houston Health Department reports 1,317 new cases of COVID-19, bringing Houston's total to 20,011. Again, bear in mind this is a two-day report, Sunday and Monday, but 1,317. On average, I think we are reporting about 700 a day, maybe a little over 700 a day. This is it's a two-day cumulative total because Health Department does not report on Sundays, although I think this coming Sunday we plan on changing that because of the holiday period, and I think we'll be reporting on Sunday, may not be reporting on Saturday. The number of people who have died as a result of COVID-19 is now 224. That is, we are adding 5 to bring that total to 224. The 5 people that we are adding to the list includes a white male in his 70s with underlying health conditions who passed away on June the 8th. What we are noticing and what you will see is that the number of Hispanics that have been affected seem like that number is also increasing. A Hispanic male in his 90s with underlying health conditions who passed away on June 16th. A Hispanic male in his 60s with underlying health conditions who passed away on May 27th. A Hispanic male in his 50s with underlying health conditions who passed away on June the 7th. And a Hispanic female in her 30s with underlying health conditions who passed away on June 18th. So again, let me remind everyone, this virus is still very much prevalent within our community, and it is deadly. It's insidious, so please take it very seriously. Of the 224 total deaths, 64 are associated with nursing homes and 3 in the Harris County Jail. The number in the Harris County Jail has remained the same for quite some time. With respect to the nursing home deaths, that number continues to inch forward. So of the 224, 64 are associated with nursing homes. Even though, relatively speaking, the fatality rate in the city of Houston remains relatively low, the number of people who are being infected by this virus continues to exponentially grow. Each day I start with the numbers as a reminder that we are still in the middle of a global health pandemic. We are experiencing a surge currently in the city of Houston, and the positivity rate is up along with hospitalizations. Dr. Persse will speak more to it, but at the end of April, first part of May, and probably all through May, our positivity rate was at 3%, got it down to about 3, and then it jumped up to 9, and then it jumped up to, it is now above 13. And Dr. Persse can elaborate on that. We cannot lose focus that our goal is to bring the number down, to blunt the progression of this virus, and to make sure that our healthcare delivery system is not overwhelmed and prevent people from getting the virus and save lives. That was our goal 2 months ago. That remains our goal today. Doctors are telling us that young people persons are getting sick, those in their 20s, their 30s, and their 40s. And as you can see today, one of the persons who died is in her 30s. Let me just say, as of this morning, like on previous days, the testing capacity at Del Mar and Butler reached this capacity quite early, before noon today. And so to try to offset some of that, I think starting tomorrow, we will be increasing the testing capacity at both sites, Del Mar and Butler, to 650 per site. So instead of 500, we are taking it up to 650, and then we're working to increase the testing that's occurring in the city of Houston. Last week, additional restrictions were imposed by the state of Texas, and I want to thank those bars and clubs that adhered to the order issued by the governor and shut down. I want to thank them. I want to thank those restaurants who reduced their occupancy from 75% to 50%. So let me thank you for complying. Unfortunately, not all businesses complied without getting additional pressure over the weekend. And today, I'm announcing the first 3 businesses. And quite frankly, I don't want to put any businesses on the wall of shame, but we will be announcing there will be 3 that are being placed on the wall. This is how the businesses were selected over the weekend. The Houston Fire Marshal responded to complaints, and after receiving a complaint, they evaluated whether the business possessed a current permit from the Texas Alcohol Beverage Commission. If the business was in the process of securing a TABC blue tag, but currently held a red tag, then they are not allowed to have patrons inside their facility in accordance with the governor's executive order, which means if they receive 51% of their business from alcoholic sales, then they are supposed to be closed and no patrons allowed. And then if that were the case, we referred them to TABC for noncompliance. 3 businesses that are being placed on the mayor's wall of shame are the SPIRE nightclub at 1720 Main Street, Poor Behavior, and that's the name of the business, Poor Behavior, at 2211 Travis, and Prospect Parks Sports Bar and Kitchen at 3100 Fountain View. These are businesses that, quite frankly, are just not serving their patrons well and not serving the city well. And I'm hoping that other businesses will not have to be added to this wall of shame. We don't want to see any businesses placed there, but this is a healthcare crisis. The numbers are going in the wrong direction, and it's going to take all of us working together collectively to make it happen. So let me just say, we are taking it very, very seriously, and I think people know. You shouldn't be in a crowded capacity, shoulder to shoulder, not wearing a mask. That simply is a formula to be infected. So you don't want that to happen. If you are going to a place and you see that a place shouldn't be open, but it is open, you shouldn't be walking into the doors. And then if you're going in a place that is crowded, where you can't engage in social distancing, people don't have in their masks, then you should turn around and walk out. It makes no sense for you to be spotlighted and highlighted on local and national news and on social media in the midst of a healthcare crisis. This is real. People are dying. People are getting sick. People are going to the hospital. People are in ICU beds, and people who are asymptomatic or infecting their loved ones. So it just doesn't make sense. And quite frankly, I have lost patience with you on that regard. So this is not a political deal. Wearing masks is not based on ideology. Those who are wearing masks doesn't mean that you're liberal and progressive. And if you don't wear a mask, doesn't mean that you're conservative or something else. The reality is that we are all in this together, and we have to blunt the progression of this virus, and we have to do it now. And if we start doing it now collectively, then I think our numbers will be better 2 to 3 weeks from now. But the numbers need to go down. We shouldn't be saying 600 today or 700. We need to get to the point where we were at the end of April, first part of May, and that's numbers, 100 or less, and hopefully to the point where it can be and get to the single digits. So that's where we need to go. I take no pride in being on local or national news, talking about where Houston is and the numbers growing and our hospitals could be overrun and ICU beds, and take no pride in that. Take no pride in people saying that if Houstonians go to another state, like on the East Coast, that they would have to quarantine and certainly take no pride in the fact that when people say Americans, if they go to Europe, well, that you can't come. Take no pride in that. So what I do take pride is that when we work together, we can make positive things happen, and I'm hoping Houstonians would do just that. Having said that, let me pause now and bring up Dr. Persse.
Thank you, Mayor. And I'm going to pick up on the Mayor's comments about the positivity rate. So again, this is the number of tests that come back positive divided by the total number of tests that are performed. And it had been expected by many, including myself, that as more and more tests were going to be available across the community, that we would wind up testing more people who were classified as the worried well. And if that had happened, we would expect to see the positivity rate would decrease because there'd be a larger denominator, and yet the number of people infected would probably remain about the same. But that is not what we have seen. The positive rate of the tests has continued to go up. And as that happens, in concert with more tests being available, and we're about to go to even more tests, and we go from a total of 1,000 to per day to 1,300 per day, it'll be an interesting opportunity for us to see. But my fear is that we'll see that number continue to rise. So I think that people need to pay close attention to that. And what that reflects, of course, is not that complicated. Is that there is more virus in the community than previously suspected. And that also should not be too much of a surprise at this point. Perhaps several weeks ago it might have been, but certainly at this point we're way past that. That's what we should have all expected. I also want to comment on the fact that yesterday I had the opportunity to travel to Dallas to meet with Dr. Birx, who's the chairperson for the President's Commission on the Coronavirus Response. And I was there along with colleagues from Dallas, San Antonio, Austin, and El Paso, and from some representatives from the state. Dr. Hellerstadt and Dr. Zerwas were there as well. And Dr. Birx focused a lot on her concern about younger people, the 20 to 30 and 30 to 40-year-old age group, and how the concern right now is that this group that is doing fairly well when they get infected, they don't get as ill, but that is the group that is going to places, as the mayor just put on the wall of shame, and spreading the virus amongst each other. And yes, those younger people do tend to do better when they get ill. They also tend to do two things. One is they go home, they spread it to other family members, who then spread it to other family members, and somewhere in that network is an elder person or someone with chronic, serious underlying illnesses. And remember, last week we did report someone in their 20s with underlying illnesses who passed, and today someone in their 30s with underlying illnesses who passed. And in each one of those cases, for every single one of these deaths, somebody passed the virus on to somebody else, and then eventually it got to this person who paid the ultimate consequence for that. And I wanted to point out that, so today I called colleagues at local hospitals and asked, what % of your ICU patients are under the age of 40? And I don't have answers back from all of them yet, and I promised them that I wouldn't share who said what. But what is important to know is, as I say that, I want you all to think for a moment, what % do you think are people in the intensive care unit that are in their 20s or in their 30s? Based on what we've been hearing, what % do you think it is? Well, it sounds like it's going to be around 15% of the people in the intensive care units are in their 20s or 30s. They're in the intensive care unit. They are extremely ill. Now, when we look at the deaths, we are seeing mostly people above the age of 60. But don't for a moment think that when people get ill with this virus, that it's like the cold, or it's like the flu even. We've heard many anecdotes and testimony that the mayor has had people up here talking about how very, very sick people feel. And so here we stand today with this virus spreading throughout the community. We're seeing the positivity rate go up. There is a concern that our younger folks are the ones who seem invincible and may be facilitating the spread, not because they're bad people, and that's not what I'm saying. It's normal behavior. I was 20 in my 30s as well, and I remember how I behaved. I was a very social person at that point. But if they think that I'm going to get sick and I'll get over it, if that's what people that age are thinking, I'll get sick and I'll get over it, recognize that somewhere in the neighborhood of 15% of the ICU patients right now are in their 20s and 30s. And so think twice before you go out and think that you won't get terribly ill with it. Thank you, Mayor.
I also failed to mention that all city-sponsored, permitted, and produced events for the month of July are being suspended. So we're not going to proceed with any city-sponsored, permitted, or produced event in the city of Houston. Those events for July are being suspended. Chief Pena.
Thank you, Mayor. I want to take this opportunity to share a little bit about the impact that the increased number of cases is having on our 911 system. Over the last month or so, our call volume has gone up by about 30%. So at the end of April, early May, we were around 800 calls for service per day. Now, consistently, we're close to 1,100 calls every shift. The increase is primarily in respiratory difficulty calls, okay? We're seeing that day in and day out. That is having an impact on the saturation at our local hospitals, and we're seeing the impact of that in our availability of units, okay? We have, I shared this at the last press conference. Over the last 3 weeks, we've had over 560 instances where our ambulances are at the hospital waiting to give report and transfer the patient for over an hour. That has an impact on our ability to be in service on the street and ready to respond to the next call, okay? So this is an issue, what we've been talking about here, the rate of exposure, the rate of contamination, and the spread of this virus is having an impact on the number of calls that we get at the 911 system, and it's having a downstream impact on our unit availability. So again, I want to reiterate, as a community, we're not defenseless. There are things that we can do, and we've been hammering at these day in and day out. Wearing your mask is key. Physical distancing and proper hygiene is going to help us get over that hump and hopefully get back to normal sooner than later. Look, this disengagement and the complacency is again just as much of an enemy as the virus itself. So we asked the community, one, to do their part, and two, to make proper use of the 911 system, okay? We have, the 911 system is reserved for true medical emergencies or safety emergencies if it's a police issue. We don't transport patients to the hospitals to get tested for coronavirus. If you have symptoms where you're getting aches or fever and you can go to a primary care physician, we recommend that you do that first instead of calling 911, tying up a unit, and you're going to be, I just want to make this clear, because you go by ambulance does not mean that you're going to be seen sooner at the hospital, okay? Now, if it's a true emergency, heart attack, stroke, respiratory distress, call 911. That's what we're there for. We do not want to discourage anybody from calling 911 in those instances. But please reserve the 911 system for true medical or safety emergencies. In regards to the occupancy task force, over the weekend, after the governor's executive order was implemented on Friday, we responded to over 300 complaints for businesses that are open, bars, clubs, and not hotels, but restaurants, restaurants over the 50% occupancy. Over 300 calls that we responded to. We've referred 3 businesses to TABC. Now, under the mayor's direction, the posture that we're taking is, again, education and voluntary compliance. Of the vast majority of those calls that we responded to, the vast majority of those voluntarily complied with the governor's order. Again, it was only in 2 instances, 3 really, that the businesses did not want to comply. On those, we simply referred those to TABC, and they would take whatever administrative actions they need to take. But again, as a community, we need to do our part to ensure that that we're trying to stem the increase in virus and contamination, because it is having an impact on not only our firefighters, police officers, but the people that we serve. Thank you.
Thanks, Chief. Chief Henner, HPD.
Thank you, Mayor. Thank you for your leadership. I just want to give a quick update for the numbers with HPD. We have a total of 190 quarantined, 140 tested positive. Year-to-date, 220 tested positive. 80 of those have returned home. Just real quick, and Chief Penn, you said it, we got to work as a community, okay? It's really not fair to, and I've received several calls over the weekend and today from good, responsible bar and club owners, okay? So just understand this one thing. You're going to get hit in the pocket with TABC. So if you want to play the games, and I'm not talking to all good people, I'm talking to the knuckleheads that's not out here doing what they need to do and not being community responsible people. We're going to have our vice units out there working, our patrol units working with the fire department and also TABC to report. So let's work together and get our community back up standing. And it's really hard and on the good bar owners and managers that's doing the right thing. We ask them to continue to do the right thing, and also know we're going to hold those who not, we're going to hold them accountable and get our city back up and running. Thanks.
Thanks, Chief Fenner, and let me echo his comments. For those businesses who are complying, let me thank you. For those Houstonians who are working with us and putting on your mask, engaged in social distancing and exercising proper hygiene, let me thank you as well. And it's more that are doing that than not. So I don't want to lose sight of that, so let me thank you. I'm simply asking everyone in order to blunt the progression of this virus to join in that effort, and the quicker we do so collectively, the quicker we can have more positive results.